Good evening and welcome to Chicago Tonight Black Voices. I'm Angel Ito. Brandis Friedman has the evening off. Thanks for sharing a part of your weekend with us. On the show tonight, Cook County is accepting applications for the nation's largest publicly funded guaranteed income pilot. Find out what that program is promising. October marks Breast Cancer Awareness Month. We talk mammogram misconceptions and early detection in the Black community. Examining the impact mass incarceration has on young people in a new 3-part exhibition. And grassroots organizer G2 Brown gives the last word on elevating community voices to solve deep social inequities. All that coming up, but our first story tonight, applications are open for Cook County's Guaranteed Income Pilot. Find out if you're eligible right after this.
Chicago Tonight, Black Voices is made possible in part by Fifth Third Bank and by the support of these donors.
At Fifth Third, we believe when diverse voices are heard and empowered, communities are made stronger, lives are made better, and the future holds greater promise for all. That's why we're proud to support Chicago Tonight Black Voices. Together, we can make a difference. Together, we can drive change.
According to the 2020 census, nearly 13% of Cook County residents live in poverty. That's nearly 700,000 people. Now there's a new guaranteed income pilot aimed at helping some of them stabilize their financial lives. The program, known as Cook County Promise, is accepting applications through October 21st. Now recipients will receive $500 a month in cash support for 2 years. It's the largest publicly funded guaranteed income pilot in the United States to date, and Cook County officials say they have high hopes for the program. Joining us now with more are Cook County Director of Equity and Inclusion, Denise Burrito. Thank you so much for joining us in the studio today.
Thank you for having me.
You.
So glad to be here.
Yes.
So glad to be here.
So excited to talk about this new program and how folks can get some money. So first, let's walk through the eligibility requirements. What is needed?
Well, first of all, they have to be a resident of Cook County and not participating in either the Chicago or Evanston Guaranteed Income Pilot. Other than that, you got to be in Cook County, have to be 18 years or older, and you have to have a household income below 250% of the federal poverty level, which is about $58,000 for a family of 3.
For a family of 3, that's good to know. Okay, right. And so then what information does the application ask for specifically in those personal details?
Well, it's very simple. It is going to be online, so that's why we have outreach centers all over, and we are hosting opportunities for people who might not have access. But it's very simple. We're not asking for immigration status. I'll start with that. We're just asking for a way to know where you are and be able to verify that income and the number of people that are in your household.
Absolutely. And so with this being an online-only application, are there ways for people who want to apply to get help submitting their applications, just kind of troubleshooting with them?
Yeah, absolutely. So we have an outreach program that has us with partners all over the city. For example, most notably, the Spanish Coalition for Housing. So there's a lot of folks the Indo-American Center, lots of immigrants serving, but there's also a lot of HUD certified nonprofits that are also participating. So again, the outreach, we know that not everyone has access, and so there are folks set up throughout the county in various capacities to troubleshoot with people and make sure that they have what they need.
So let's get into the selection process. How are people chosen and how will they receive their money?
So it is random and it's a lottery. Okay, gotta let you know that, because let's just be real, 36% of the people that live in Cook County would be eligible for this. That's a big number, right? And to date, we've already had over 160,000 applicants to date. And we're talking, this is gonna be for 3,250. So clearly, You know, we have to do it as
right.
we have to do it as a lottery. That, you know what I mean? So once we have all the information in, it's just random. We have a partner that's going to help us randomly select those 3,000 families.
And now, beyond 3,000 people having the opportunity to improve their financial standing, what would a successful outcome look like for Cook County in this program?
So that's a great question. And what we're really trying to do with being the largest publicly funded is we're trying to push the federal government. Let's be real, right? This has been done on the local level in Stockton, California, parts of Ohio, Southern California, all public-private partnerships. As the second largest county in the country, this is a clarion call, right? We're basically saying, like, for us, success would be that we already know that the data has told us we want the data to be on a wider scale. When people have access to cash, this is going to save families that second job that gets eaten up with childcare and transportation. And so when someone has that extra cushion, you know, we know for a fact people are going to build nest eggs. People are going to be more stable. And the amount of people, this is the largest that we're having. And so we're hoping that it will call on the federal government because, you know, I just told you 36% of Cook County is eligible. So for us to get this in our budget long term, that's a very tough proposition. But we do believe that with our data, we're going to help bring other big counties like Harris County and Houston, LA County. Yes, I'm calling out because I think the more of us that do this, it'll drive, just like everything else, it'll be this groundswell and it'll force the federal government to look at this.
Now, as we mentioned earlier, this is an ambitious pilot. $42 million are being funded by the American Rescue Plan Act. Now, any future plans to grow and fund the program beyond this initial pilot?
Well, only time will tell. I'm happy to plug another thing that we have, which is our equity fund, and that is a special purpose fund designed for equitable spending, right? This is being paid for through our ARPA dollars, but we think of it as a down payment. And when the idea is, if we are able to do this and keep it be part of our budget, we know that we have a special purpose fund every year that we can look for longitudinal equitable investments. So if it were to happen, that's one of the places that I think this money could come from.
Now, last question, we're running out of time, but I would love to know why do you think that this program is the right approach?
Because cash is king. Like, the reality is, you know, we've had Band-Aids and initiatives throughout the years, and nothing's wrong with programs. But folks that are living in poverty are some of the most resourceful people in this country, right? And so what better way to invest in them than to directly invest in them, right? Give them the money and let them decide what to do with it. And we know that they're going to enrich their families, and this is going to make communities better, right? So anybody, any family or household that is part of this program, that's not just going to be in for them. It's going to be for the folks around them, the places that they patronize. We're really excited to see how this is going to lift the county as a whole.
Well, thank you so much for these tidbits. Our thanks to Denise Burrito. Now, up next, addressing disparities in breast cancer detection and treatment. Stay with us. Breast cancer is one of the most treatable types of cancer when detected early. And despite that, it's the leading cause of cancer deaths among Black women. According to the American Cancer Society, Black women are 41% more likely to die from breast cancer compared to white women. They are also less likely to be diagnosed and less likely to receive treatment. Joining us now to share more about those disparities during Breast Cancer Awareness Month are Annie Jones, president of the Sisters Network Chicago chapter, Tina Francois Blue, principal consultant at Francois Blue Consulting, and Dr. June McCoy, professor of medicine at Northwestern University's School of Medicine. Ladies, thank you so much for joining us. Annie, let's start with you. It's my understanding that you have beat breast cancer twice in the past 23 years. Knowing what you do now, can you share why you believe early detection is the best prevention?
Yes. I was diagnosed in 1999, the first time, and the tumor was small, and I had a lumpectomy done. And 15 years 15 years after that diagnosis, I was diagnosed again in the same breast. And because it had come back in the same breast, I opted to have a mastectomy. I didn't want to take any chances, and I was afraid that maybe if it came back in that breast, that it may travel somewhere else. So the having my mammograms yearly gave me the benefit of catching the tumor early enough that it could be treated with chemotherapy the second time, no radiation because it was the same breast. And it was because of that that I feel that, I'm here today.
Wow. Wow. Now, Tina, this kind of brings me to my next question with you. You say that the cost of preventative measures means that we're asking women to essentially pay for their own lives. What do you mean by that?
I mean that for Black women, the standards of care in terms of how and when women are being recommended to go, that has changed over the last little while. So for a very long time, it was, at 40, you go and you begin to get your mammogram. And particularly for Black women, that's very important because all of, us who are in a space and doing grassroots efforts, talking to women every day on the bus, in the grocery stores, making sure that we're repeating a consistent message was very key. And then shortly, the recommendations to change those guidelines to potentially 45 or even 50, that took all of that work and put it on its head because women who weren't really wanting to go in the first place were now, it gave them an excuse, a reason, I wouldn't say an excuse, a reason for them to delay care because their doctors were not advising them. And particularly for Black women, young Black women, that has been dire because there are some young Black women who have found their, because they're not being recommended to go, obviously they're not 40, they're in their 20s, some of them are in their 30s. Some of them, in their early 40s, when they're finding things, their doctors are not advising them to go through the standard process. They're not advising them to go and get mammograms. They're advising them, just wait and see. Well, if it's an aggressive form, that aggressive form could have metastasized by the time they would, then be of age to then go the typical route. So some of the women that I've met have paid for their own mammograms, which has caught their cancers. And that is how they've been able to be here today. That's not an option for all women to be able to pay out of pocket for a service that is a preventive service that once they reach a certain age, it would be covered. So there's a lot of policy issues at play that we need to still be mindful of that are very specific to Black women that are important to save our lives.
Wow. Now, Dr. McCoy, just jumping to you, thinking more about mammograms, I know that there is a myth, right, a stigma that mammograms can cause breast cancer. So can you tell us a little bit about why that is wrong and why these early preventative measures, like Tina just mentioned, are so important?
I think I'll start off with the fact that mammography is not comfortable. It's an uncomfortable procedure. And I've always said that if men were the ones with primarily getting breast cancer, they'll come up with a better diagnostic tool. With the new 3D machines, it's not as bad. I had my mammogram and I thought, not too bad this time. But no, that is somewhat of an urban myth. I think it came out of true concerns about the additive over time effect of radiation to the breast. So it was not something that I think people came up with, just willy-nilly. It was with some thought, but the studies have not borne that out. Mammography remains important. And we want women to have that. And I'm going to go with what Ms. Francois Blue and what Ms. Jones said earlier. Awareness and early detection is important. And I think if we can't dispel this myth that mammography will lead to breast cancer, then we're going to lose more of our own women to breast cancer. And as certainly they're both alluded to, we can get recurrent breast cancer more often among us, much more aggressive so-called triple negative breast cancer in in Black women like us. And so early detection, being individualistic in how we as doctors approach women, especially Black women, who might be finding lesions early, and making sure they get to mammography. And then policy changes, as stated before, that understand, just like with Black men who get prostate cancer earlier, more aggressively, Black women fall into that group, and we need to make sure that where insurance coverage is available, that it's flexible enough to cover women, even when they're not at the so-called age that ACS, the American Cancer Society, or the U.S. Preventive Services Task Force state. It will take us as individuals understanding that breast cancer is a really bad thing in our population.
So we've talked about early detection, but now let's get into support. Annie, I know that you are the president of the Sisters Network Chicago chapter. Can you tell me a little bit about the work that you all do to ensure that your members are feeling supported, whether that be emotional support or maybe even financial support, if that's an option as well?
Yes, we focus on 4 or 5 different things. We give support, support meaning that shoulder to cry on, that warm hand to hold. We do outreach. Okay. We go into the community. We meet the women and men where they are. We take information out into the community so that the women can be educated. They can't always go to different facilities to get the information. They don't always look at TV. So we go to those neighborhoods and pass out breast health information. Advocacy. When the patient arises, we are available to go to Springfield or Washington, D.C. to advocate for bills that will be beneficial to women diagnosed with breast cancer and breast cancer survivors. And also, we are able to offer financial assistance to women diagnosed with breast cancer that may need mammograms, they may need support with their utility bills. We've given financial assistance to women that need prostheses and bras, and we've also given financial assistance to women that need compression sleeves, those sleeves that women have to use when they develop lymphedema after surgery.
So many resources I didn't even realize that women needed in the going through and post kind of recovery periods. Wow, that's so interesting. Now, Tina, I want to jump back to you because I know that you do a lot of consulting work with breast cancer organizations. So Annie just talked about different ways that they do support women, but what additional support do you believe that these women or these organizations need that they're not getting?
Well, I think importantly, particularly for organizations like Annie, it's a pleasure to know them and to see them work. In a way, so if you think about the cancer community as a whole, everyone has a role that they're playing in providing services and getting women to care. But the grassroots organizations particularly, I don't think that they're getting the full appreciation from the philanthropic community to understand the very unique role that they play in connection with other academic institutions, other medical institutions. There is an appreciation for the way in which grassroots organizations like Sisters Network, like Sisters Working It Out, how they're able to connect with women in a very real and personal way. But in terms of how that translates with grant dollars, how that translates to other types of relationships that have a much more broader impact that can allow a Sisters Network, a Sisters Working It Out, to be able to then multiply how many women they're able to reach. Those things don't happen as quickly as they do for many others. And I think that is a missed opportunity. And if we're looking to advance equity, let's advance economic equity for these Black-led organizations that are out here, the women who are at risk, who are working on behalf of their sisters and their aunts and their daughters and their mothers. Help them to be able to give them the resources to make sure that their infrastructure is solid so that they're able to grow sustainably.
Now we're running out of time here. It looks like we've just got about 30 seconds left. But Dr. McCoy, I want to end it with you. If you could share any tidbits on the best ways that we can practice and live the best lifestyle, I guess, to prevent this from even happening to us. Are there any tidbits that you would like to share, or would you say that that's also a myth on how you live your life and lifestyle choices?
Lifestyle choices certainly quite important. Diet is important. A low-fat diet, and I'm not saying eat food that you don't really like, but kind of cut back on the fat. Staying, exercising, so you're healthy and ready to fight the disease if it comes your way, and really staying connected with your doctor. I know the time is almost running short, but there is inequity, and many people don't have access to physicians. But try your best to reach out to grassroots associations like the ones that are being run by these wonderful women here, and trying to find a way to get your mammogram, to get your breast examination, and to get sent on or referred if you need to have some procedure done because an abnormal finding is noted on your mammography.
That was beautifully said. Our thanks to Annie Jones, Tina Francois Blue, and Dr. June McCoy. Sky Art, the Weinberg Newton Gallery, and Arts in Public Life are partnering for a 3-part exhibition series exploring the impact incarceration has on young people by debuting artwork created by incarcerated youth. Now, one of the missions of this collaboration is to encourage the youth they work with to focus on where they're going, not where they started.
We're trying to rescue some of the innocence that it was never really afforded to these kids. We know that our poor Black and brown communities are over-criminalized, and oftentimes through the foster care system, through poorly funded education, all the way through incarceration, these youth are never afforded the innocent childhood that all children deserve. And so in some ways, we're trying to examine that and create a space for that, not only in the exhibition, but when we go into these facilities and we work with youth.
Now, the 3-part exhibition kicked off this week at the Weinberg Newton Gallery and also features work from contemporary artists who create artwork surrounding issues of incarceration. Now, part 2 will debut at Arts in Public Life on October 21st, with the final exhibit installation at Sky Art on October 28th. And though now it is nearly a decade later, the closing of 50 under Chicago public schools in 2013 still feels like an open wound to many Chicago communities, especially to the children who say their education and lives were upended. Now, community activist G2 Brown says that right now we are seeing the reverberations of the trauma in the city. Here, Brown gives the last word on how he says deep inequities in schools are just one part of a decades-long pattern of disinvestment and how it will take everyone to reverse that pattern.
I'm G2 Brown. I'm the National Director of the Journey for Justice Alliance. We are a national alliance of community-based organizations in 38 cities around the country that use community organizing to win equity in public education. I sat on the local school council here at Diet for 10 years. When I was the education organizer for the historic Kenwood Oakland Community Organization, we fought to save this school, a 4-year campaign that resulted in a 34-day hunger strike. Black parents who were deeply engaged in the education of our children had to go to those lengths in order to be heard, to actually starve our bodies, put our bodies at risk for 34 days. But we did that, we won, and the school is here for the community now. The fight for Diet kind of showed that this is not just a local issue, this is a national issue. People are ignoring the deep education inequity that exists within American schools and saying we have failing schools. But the truth is, as a public, we've been failed. We have a saying that the foundation of any nation are the institutions that lay the structure for the people's development. If you pay taxes, whether you have a mortgage or you buy a bag of potato chips, you have the right for a reasonable return on your investment, which means that we should, as people that live in this country, we are supposed to have good schools, good housing, health care, food production and delivery systems. And so while we enter through the lens of public education, we understand that we cannot wage single issue struggle because we don't live single issue lives. We have an opportunity now to really reflect on the Chicago that we're looking at. The crime that we're seeing, the young people that are pulling people out of their cars, who are they? The fact is that these are the children of the school closing era. These are the children whose school was shut down, starved of resources. They went to 2 and 3 schools in 8 years and never received the quality of education they deserve. The chickens have come home to roost. We have to have policy and practice in place that lifts up the voices of those directly impacted, because the harm that's been done through massive school closings, through deep municipal disinvestment, somebody has to be accountable for that. People can talk racial justice talk, but white supremacy's walk is over. So we're pulling together a coalition in this city right now to move a quality of life agenda. That's how we build a new Chicago. We got to lift those grassroots voices up in Pilsen, in Little Village, in Bronzeville, in Inglewood, in Uptown. And we got to realize that we all in this together.
Now, you'll find more in our Last Word series, as well as Brown's organization, Journey for Justice, on our website. And that's our show for this weekend. Join Brandis Friedman and Paris Schutz next week at 7 on Chicago Tonight. Now, for all of us here at Chicago Tonight Black Voices, I'm Angel Ito. Thank you for sharing a part of your weekend with us. Stay healthy and safe. Good night.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a Chicago personal injury and wrongful death firm that is proud of its partners named Illinois leading lawyers by the Law Bulletin Publishing Company of Chicago.